My name is Sujith Konan. I'm a hip and knee surgeon, which means I see people with hip and knee problems. I talk to them about solutions for hip and knee related problems. And the bit where I come in most is I help them with the surgical solutions operating on their hips and knees. Growing up as a child, I knew I wanted to be a doctor. I like the fact that a doctor was a responsible citizen. He would help people out. He has to meet complete strangers and understand their problems. And he's also then responsible for that individual almost for the rest of their lives. I did my medical training in India, south of India, a place called Bangalore. So in India, you see a division in the society. So you have the extremely rich, the extremely poor, and most people in the middle class. So depending on which part of that spectrum the patient would be in, you would see people who are not able to afford any of the basic medical necessities versus people who could afford the real high-end medicine. Part of the reason I moved to the UK was to be able to deliver the same standard of care to all the patients I came across and practice that kind of uniform medicine wherever possible. I came to the UK and started working in various parts of London during my initial training. I knew very early on that I wanted to do orthopedics. So I got on to an orthopedic training program and completed my training back in London. I've spent a substantial amount of time working in other countries, visiting other centers, working with other surgeons. For me, I spent a lot of time operating, getting taught how to do complex procedures and how to deal with these complex presentations and patients. I think what has helped most with all these visits and this time spent abroad is that I have a better understanding of different cultural needs, how different cultures think, what their expectations are from surgery. So I think when I now look at my patients, I try and use that information, I use that knowledge when I counsel them regarding different procedures. And I also understand better where patients are coming from when they are going towards one particular choice of treatment. And I think this has been extremely valuable for me. I realized that surgery has a great impact on people. What I do would make an immediate difference to that patient straight away. There's no other field in medicine, I would say, where you can have that direct impact on a patient and make a big influence on people's life. Lots of patients stick out in my memory. One that I particularly remember is a patient I'd seen immediately after the COVID pandemic. A 50-year-old who was wheelchair-bound. He had arthritis of both his hips. He was in a state which no one should be at the age of 50. He underwent sequential hip replacements at Hospital St. John's in Elizabeth. And he was delighted with the outcome. And within a few weeks, he forgot that there was ever a problem, was back doing everything he likes to do, playing sports, having a good function, and having a good quality of life. And this is often the success story we see with joint replacements in the hip and knee joints, and every time this happens, it's a great result.